Friday again. Well, thank you very much for showing so much love to my shows. Um, it's year end, December, and I know everybody is busy planning for Christmas parties. We have one tonight for our clients very close to our office. So today I'm going to talk about very, very important topic. Recently, actually, in last couple of years, information has become a very, very powerful medium for people to render a good patient care as well as empower their patients with some engagement where they can ask, seek information from their providers. But at the same time, providers are also responsible, healthcare providers are also responsible to share the information with their patients as well as any third party vendors. Listen, it's very important that you understand the difference between sharing the information between patients and sharing the same patient information with third party vendors who can create a bridge or exchange to further share that information with somebody else. I'll give you an example. So, if a medical practice or a medical group seeks information about a patient from a hospital in an exchange or in a way where in a HIPAA certified electronic way where hospital is supposed to share that information with the medical practice, that is called PHI. We all know about it, and we all are bound by the rules for PHI and HIPAA. But if the information is related to the patient and you're supposed to share with the patient, but if you don't share it, it's called information blocking. That means, as a physician, as a healthcare provider, you are blocking the information which is public information or which is a private information, but it is supposed to be shared with the patient, but you are blocking the patient to exchange or access that information which belongs to him. And that is called information blocking rule. And that is very, very important. Under Cures Act, actually, last year, in April 2021, this act was passed and it binds physicians, medical practices, medical group that if they feel appropriate to share that information for patients, then they have to share it in a manner that it is secure and it gets to the patient in a timely manner. So, timely manner is very important to understand. I'll give you another example. So, if a physician has to share the reports or results of MRI or labs or pathology labs within 24 hours with the patient through patient portal or through any kind of digital way, then they should provide those results on their patient portal and patients should be able to access it online. If they don't do that for a reason, then they have to provide the reason. What was the reason they did not supply or share that information for the patients? Eventually, patients should have the access of that. So, this information blocking rule we are going to talk about today, and I'm going to share some slides so that you understand why this is very important in your medical practice to understand whether you are not becoming a victim of information blocking. Because if patients will come to know about this and if they feel that their information is not being shared with them in a timely manner or appropriate manner, they can literally come after the medical practice. So, what is information blocking? I have already explained you in a larger picture. But in general information, blocking is an action by a healthcare provider. Again, there are three actors here, three players. Before we go to the actual legal information blocking um, definition, I want to show you something more. I want to show you this graphic. Look at this graphic. This is from the CMS website. The Office of National Coordinator, ONC, Health Information Technology. So if they show, if you are an entrepreneur, if you are a healthcare startup, anybody who is listening, this medical groups, healthcare IT vendor, these are the three information blocking actors. Very important. Healthcare provider. It can be anybody, nursing home, hospital, medical group, MSO, medical billing companies. Anybody who is a healthcare provider falls under this constitution. So that's a number one actor in this law. Number two, health information exchange. Health information exchange is a technology which is being used to share the information. It can be anybody. It can be an exchange between a hospital and a provider, hospital and a doctor, or very simple patient portal between a hospital or between a physician and patients. So any exchange which shares the information, exchange the information, they fall under this category. So number two actor. Number third, and which is most important, all of my startup entrepreneurs, health IT developer or a certified healthcare IT firm or a company or a consultant or a person who touches the healthcare information, who uses it, because most healthcare apps developers, most healthcare softwares, you remember I spoke about public policy very loud in all of my shows. Public policy derives innovation in your solutions. Public policy drives innovation. So this is public policy I'm talking about. Cures Act, which was launched in April 2021. Very important for healthcare entrepreneurs to understand this. So if you are building a solution or a patient portal in lieu of this particular act, Cures Act, then you have to really uh, follow the policy. And this public policy, basically you have three actors: healthcare provider, health information exchange, and you as a startup entrepreneur, healthcare IT developer. So these are the three main players. Now we will go back and we'll talk about the most important thing, the definition of information blocking. So here is what I'm going to show you. The information blocking is basically, this is what ONC has stated, that an action would satisfy the information blocking likelihood requirement. Under these circumstances, there is a reasonably foreseeable risk that the action will interfere with access, exchange, or use of EHI. Now, what is EHI? EHI is an electronic health information. Now, it is not PHI. I know we are talking about PHI, HIPAA, and everything, but EHI is more focused information about the patient, which patient should have the access, not between the providers. So here's the difference between a hospital and a physician. You are protected by HIPAA, but between physician and patient, the information which you share, and if you don't share it in a timely manner, that is called EHI. And that can consist of many things. EHI means your demographics, your lab results, your X-ray reports, even your review of systems. There are several things which you can share with patients, but doctor has to decide. So the definition of EHI would include medical records, billing records, payments, claims, case management records, any records, even sending a patient statement bill, it falls under EHI in whole or in part to a medical group. And that's where it really gets really gets dirty, because either you provide that information to the patient in a most appropriate and safe and secure manner through exchange. If not, then you should have enough um, prevention. So you should have enough explanation that why you are not giving the information. So what actions could constitute information blocking? We will talk about it. So medical group is regulated by the information blocking provision. We just talked about it. Action involves EHI, which I have explained to you what EHI means, and the action is likely interfere with, prevent, or materially discourage access, exchange, or use of EHI. So just to give you an example, so doctor's office, let's say cardiology office, and they have an access to patients' labs, but sometimes they decide not to give that information on patient portal. They want patient to come into the office and doctor will talk to the patient face to face. Now, here, if they explain that to their patients, or their office staff knows about this and they tell this to the patient that, hey, we have the information available, we can provide it on your portal, but for some reason doctor wants you to come make a visit, and you come in the office and we'll explain it to your patient. Now this could be really dangerous here, because this patient has a rightful he has a right to access his own information through patient portal. So, but at the same time, if you have a logic that the patient may interpret that information in a wrong way, you can say that to the patient, and the patient has to take another appointment and come and see the doctor for that. So that is where you have to understand the difference. Knowledge of the action by the medical group. So the action is not required by law. So you're not required by law, but it can have repercussions. So I'll tell you what are the repercussions very soon. But I hope you understand what that information blocking I'm talking about. Information is basically, let's say, patient has a balance of $30 or $50, and if you have not sent him a bill, he's not supposed to pay you. And let's say, if suppose um, patient has already um, paid his balances, his deductibles. He has already met his deductibles. But if your office is not aware in real time benefit checks that, and you are constantly sending him bills, um, and he can come back and say, hey, when I have already met the deductible, why don't you send this bill to the insurance company? I should not be paying that. And that can become a legal issue. You need to take your billing department, your office staff has to really, really make sure before sending a bill or a statement that patient owes that in under this information blocking act. If you're providing the information, provide the right information. So limiting or restricting the interoperability of health IT, such as disabling or restricting the use of a capability that enables sharing EHI with users of other systems, or restricting access to EHI by certain types of persons or purposes that are legally permissible, or refusing to register a software application that enables patient access to their EHI, assuming there is not a legitimate security reason that meets the condition of the security exception. So as long as there is no security exception, like in a patient portal, let's say you say, oh, it's a third party application, third party information to provide the lab results, cardiac lab results to the patient, or any kind of pathology results, or MRI results, or anything. As long as that EHI is secure, and you are legitimately, your medical group thinks that it is not violating any security exception, then you have to provide that information to the patient. If you hold it to yourself, if you don't provide it just out of sometimes you are scared of providing too much information to the patient, and if you do that, sometimes it can fall back. So that's where this law, information blocking law, basically, it's that public policy. It protects patients so that they can get their information or EHI on time. Now, for entrepreneurs and healthcare IT firms, at the same time, it's very important to understand how much information you are supposed to provide, and what is the level of access and exchange of that information you have to provide in the system. I know in some of our, like, let's say the hospital is supposed to provide patient demographics, review of systems, or any other details about the patient through a portal to the physicians. And further, physicians are supposed to provide that information to the patient. If for some reason that technology is not working, so for some reason it is not working, then yes, that is an exception. You can always say, hey, we have the capabilities of providing that information to the patient, but that capabilities or skill set is not working. We don't have technical technical skill set, which because of that it is not working. So any restriction on access, exchange, or use may be expressed in the contract's license terms. That is related to EHI. So the difference between EHI and PHI, you understand it. Now, where is the opportunity for startups? So far I've explained you what is EHI, what is the public policy, and where physicians are facing the challenges. Now, it is very important for entrepreneurs and startups and consultants to understand where is the opportunity. Where is the opportunity to train people? Where is the opportunity to find exceptions in the policy? Where is that you can empower physician's office with the right type of policies, with the right type of privacy issues, how to implement those exceptions into your solutions, and you can minimize their risk of sharing that information with their patients. It's all about how you can minimize the risk and you can earn their trust. It's the most important thing is earn their trust, and see that can create a solution where they can share the information they're supposed to share about the patients or EHI with their patients. So that's where I think, in my view, there are some opportunities for consultants and entrepreneurs. And um, traditionally, all medical groups and all doctors' offices, they have been talking about this information blocking. They have been talking about this with their IT vendors or EMR companies or billing companies. But now it's time for outsourcing. So for consultants, you can really act as an outsourced chief privacy officer for large medical groups, small medical groups, and you can tell them that, hey, these are the problems. This is the information you're supposed to share on your patient portal or any way with your patients, but you're not sharing it. These are the challenges. These are the privacy risks. We can do an HIPAA audit. We can do a different type of IT security risk analysis, whereby we can minimize the risk and make the practice compliant. You can also review current policies and procedures for the medical group because constantly need to be updated. So we need consultants or entrepreneurs who can create, um, monitor, or go through the policies and procedures of medical groups constantly, because if they don't change it as per the public policies which are announcing every year, uh, and if they are still thinking and working on the obsolete uh, policies, then this can come up as a see. Think about the penalties are at least $1 million. You can easily get a lawsuit of $1 million if the information block this rule is not properly followed, or if a patient can come back after you that he asked for the information from a doctor's office and that was not given to him on timely manner. So it's very, very important that all physicians, medical groups understand why this Cures Act, and under this Cures Act, this particular information blocking rule is critical for their medical practices. Coordinate with your health IT vendors or EMR companies. So if you have a EMR company, you have pay, IT guy, talk to him, ask him that, hey, can you go through our entire technology again? Can you see what our patient portal, what kind of information we are giving to patients, and is it HIPAA compliant? Is it ready? We can use some of this information. Talk about it. Evaluate all data elements, because it's very important to evaluate the data elements coming from the hospital and also going to the patients, because whether it's demographics, review of systems, history, patient results, pathology lab results, X-ray results, MRI reports, anything, even patient statements, case studies, any case reports, any information you have about the patient. Review all data elements time to time. Even if you're a small practice, one doctor office, five doctor office, doesn't matter. It's very important. Wherever the data is, your eyes should be there and you should be able to monitor and track that data. It is not the responsibility of your EMR or anybody else. Patient will sue the medical practice. But medical practice, it's very difficult to go back and then sue somebody else that it is because of the third party audit you did that. So, and again, these are not a clinical lawsuit, these are more operations, IT related. So you have to talk to your IT guy, billing company, EMR company, whoever is taking care of these things. Information blocking, patient portal, information to patients, it's very critical, and it has to be a timely manner. So everything depends on how timely you give the access of that information to your patients. Consultants who are doing training and implementation of the EHI, that's again a very good opportunity. Uh, if you have the knowledge and expertise in that area, you can go into the practices, you can talk to them and provide training and implementation, how EHI can be shared with their patients, how it can be implemented. And most important thing is basically educate the physicians and earn their trust and give them the trust and confidence that, hey, your processes, your policy and procedures, these are exactly as per the law, as per this cures act, and it is very, very important act. So I have explained to you, about this information blocking rule, three important actors, doctors. We talked about the information exchange. We talked about your role as a startup entrepreneur, healthcare IT developer, consultant, trainer, whoever you call yourself, if you're seeing my show. And fourth important thing, identify the exceptions in that Cures Act, where you can save medical practices and how you can empower medical practices with your solution, where it can generate confidence in physicians and it can also generate trust with patients, because that's the most important thing. If patients trust it, they are going to use the solution. They are going to use the solution. It's going to protect the medical practice in the back. So if you have any questions, I'm here to answer your questions, but I really, really enjoy talking to you every time I do a show here. I wanted to talk to you about a few more things. So, what is the third party vendors? Because we talk about this entire trust or this bridge. It it is, so I'll give you another example. Like if you have connections with real time benefit check, any third party connections, if you have connection with um, um, pharmacies, wherever you submit your information and information uh, third party vendors or patients, this rule applies to that. With this, I'm going to let you go today, but I will give you very important. Go to our website. By next week we are going to start a blog where all of my Vimeo videos, these are on my channel. I have a YouTube channel, you can see it's Kunal Jain. You can go on my LinkedIn, you can see the previous events, and you can see all the PHI information or EHI information, or the topics, different kind of topics I've been talking about. It's very important. Go through those topics. I try to keep them organized as much as I can, but even if not, always ask us. Our website is practiceforces.com. You can check our blogs there. And those who are coming, those who are my clients coming to our party tonight, I'm going to see you tonight. But with this, thank you very much. Have a fantastic Friday. I'll look forward next week for a new topic. Thank you.